Hello there, welcome to another OET speaking lesson, and this one is all about explaining why antibiotics won't work for a head cold. I'm sure you've had patients who come to you demanding antibiotics, but they just don't work for a head cold. So how can you tell your patients this in a polite but firm way? In this lesson, we're going to be doing some ear training. So we're actually going to be listening to a consultation about this topic. So we'll do some listening first. We'll then pick out some useful phrases and we'll also look at some idiomatic English, not for your use in your OET speaking, but actually just in your everyday lives. When you start working in an English-speaking country, you may come across these kinds of phrases. So we'll have a look at those as well. And this is a session for everyone. It's actually focused on a nurse speaking to a patient, but as I say, it's going to be useful for all of you because of the ear training, the phrases, and then that idiomatic language. For those of you who don't know me, hello, my name's Sona. I'm your online OET tutor with Bose Learning, and I'm a premium preparation provider of the OET. I'm so happy that you've come to watch this video with me and upgrade your OET with us. So, first of all then, let's listen to a real consultation, and I'd like you please to make a note of the following phrases. All of these are based around the assessment criteria. So, first of all, we'll listen, and you're going to be making a note, then we'll listen to the answers, and then we'll see why they work before moving on to look at the idiomatic language I mentioned. Okay, here we go. First question. I'm going to move these along as we listen, but the first one is, how does the nurse initiate the consultation? Here we go.
How can I help you today?
I'm suffering with a head cold.
Right.
Everything really.
Yeah.
I've been taking a medication and going to the chemist normally, so I don't want to worry the doctors because they're busy, what have you, or nurses, what have you. So I've been trying to get away with the medication from the chemist.
So how long have you had the head cold for?
I've had this. It started last Thursday.
Thursday, so not even a week yet?
No.
No. Okay.
But I've got up this morning and I feel quite heady, really, and you could possibly hear me. My nose is...
So your nose is still blocked?
It's still blocked. I just feel a bit iffy anyway, really.
Yeah. When you get these viruses, like a flu
Yes.
they make you feel very iffy.
Yeah.
Viruses make you feel ill. It's just that viruses don't go away with antibiotics because that's bacteria, and that's so people always think, oh, they're just fobbing us off. Flu and all the viruses are really horrible. They just poleaxe you. So.
Okay, let's listen again, but this time with the answers now. Here we go.
How can I help you today?
I'm suffering with a head cold.
Right.
Everything really.
Yeah.
I've been taking a medication and going to the chemist normally, so I don't want to worry the doctors because they're busy, what have you, or nurses, what have you. So I've been trying to get away with the medication from the chemist.
So how long have you had the head cold for?
I've had this. It started last Thursday.
Thursday, so not even a week yet?
No.
No. Okay.
But I've got up this morning and I feel quite heady, really, and you could possibly hear me. My nose is...
So your nose is still blocked?
It's still blocked. I just feel a bit iffy anyway, really.
Yeah. When you get these viruses, like a flu virus,
Yes.
they make you feel very iffy.
Yeah.
Viruses make you feel ill. It's just that viruses don't go away with antibiotics because that's bacteria, and that's so people always think, oh, they're just fobbing us off. Flu and all the viruses are really horrible. They just poleaxe you. So.
Okay, so you've probably been reading along this time with the answers and you've noticed these words in white. These, of course, are the idiomatic expressions. We'll come back to that in a moment. But for now, I'd just like to look at why these expressions are so good, especially in comparison with the assessment criteria. So first of all, nice simple opening. How can I help you today? It's a very open question. So remember, we start with open questions before moving on to more closed ones. Then duration, that often comes up in your role-play task cards. Ask about duration. Of course, you need to change that and you can say something like, so how long have you had the cold for? Then checking she's understood. So again, that's part of the criteria. Summarising, checking. She repeats Thursday and then she just confirms. So it's not even a week yet. So it's not Thursday, 2 Thursdays ago. It's just been last Thursday. Then she does pick up on the patient's cues. So he mentioned he's got this blocked nose, so he can't really breathe properly. And that also shows the patient that she's been listening, she's empathising, and echoing in this way is quite a useful technique for your role plays and of course in real life. And then relating the explanations to the patient's concerns. So she's picked up on the fact that he's got this, and he actually mentions feeling iffy, and she relates this to the flu virus, the flu-like virus. So flu here, virus, and iffy, she's repeating his own words back to him. And then the explanation that antibiotics are ineffective. Viruses make you feel ill. Viruses don't go away with antibiotics. They are ineffective. Okay, let's look at these expressions then, these idiomatic expressions. As I say, they're not really for your OET, they're just for your general knowledge in case the patient uses this with you. So flu-y, as I said, is flu-like virus, and iffy is a great word which means not very well. You don't feel right. Something feels iffy. It doesn't feel right. You don't feel right. So it could be something like, oh, that milk smells iffy. It doesn't smell right. Or my stomach feels iffy. I feel iffy. I don't feel right. Fobbing us off, so people think we're just pushing them away for no good reason. So fobbing us off, they think they're just pushing us away, but actually it's not true. We have a good reason for not using antibiotics. And poleaxe just means they really hit you as though you've been struck on the head. Viruses are horrible. They just hit you over the head and you feel terrible. They poleaxe you. Okay, so that comes to the end of this lesson. If you liked it, I'd be so happy if you could help me grow this channel by pressing that like button and subscribing to us, and also sharing it with a friend or a colleague. That would be fantastic. If you do want more help, then why not take a look at our on-demand courses for the OET? I'll put in some discount codes in the information box below. I've got loads more for you as well. So there's nursing, there's doctors, there's pharmacy, there's reading, there's writing, and listening, of course. So have a look at some of our other videos. And if you'd like to sign up for our free newsletter for a regular dose of all things OET, check out the link below. Thanks again and see you next time. Take care. Bye bye.